Hi, welcome everyone. So today's conversation is focused on living with myeloproliferative neoplasms, which we call MPNs for short, and how tracking symptoms can empower you to advocate for the care that you need or the care of a loved one. So I'm going to start. I've been asked to start with my story, and I'll make it short. My story is basically over 30 years. That means it's hard to make it short. But I was diagnosed 30 years ago with essential thrombocythemia, which is ET. It transformed into PV, polycythemia vera, and then eventually became myelofibrosis, which is what I have now. I've had several symptoms along the way. I've been on a few different drug therapies along the way. I've had life-threatening clots and life-threatening bleeds, which of course are, in conflict with each other. And now I am on a clinical trial, doing great. They call me the poster child for this clinical trial, and it's been 5.5 years. So I'm always proud and happy to speak to other MPN patients, people living with MPNs, particularly since I didn't know anyone else living with an MPN for the first 20 years that I had this disease. So today's discussion is brought to you by the Patient Story, where our mission is to humanize cancer. We've had more than 100 million views of our in-depth story videos that mostly feature patients, sometimes caregivers, care partners, and of course, physicians and other care professionals, clinicians. Our goal is to help promote self-advocacy and connection. So for today, a couple of housekeeping items before we get started. We do want to thank our sponsors, Incyte and Karyopharm, for their support of our educational independent program. This allows us to be able to do some more content like this one and for free, or at least at no cost to you. And the Patient Story does retain full editorial control. While we really hope this is helpful, this is not a substitute for medical advice. Please still consult your own healthcare teams when making your decisions. And finally, we really want to hear from you. So there's going to be a survey that pops up after the discussion closes. It'll only take a couple of minutes, but please share your feedback on today's discussion and also what you want us to cover next. So I'm joined by two other amazing people who also advocate for those living with MPNs.
Hi, Ruth. My name is Nick. I am a polycythemia vera patient. I was diagnosed in 2016, so approaching the 10-year mark, which is a big deal. I, like you, Ruth, have experienced a range of symptoms throughout my journey. Everything from itching to bone pain. I am experienced different treatment options and currently on a drug doing very well.
That's great. And what about personally, family, father, son, daughter, doggy dad?
Yeah. I am a husband to my beautiful wife, Kara. I have two boys, Jake, who's 7, and Nick, who's 12, that keep me very, very, very active.
So I am a wife, a mother, and a business owner, and a coach and mentor. I've been a business owner for nearly 20 years. Initially starting out in the beauty industry, owned a nail salon. And then in 2021, I pivoted to salon suites and then an event space. And then life happened. I received a diagnosis of ET. I believe it was 2018. I went through a series of different doctors and ended up at Emory in Atlanta, where the oncologist there put me on a new medication that had just came out of clinical trials, and it was showing positive results. And so he put me on that medication because he believed that at that point I would benefit better from being on that. And eventually my levels did begin to level out. My platelets counts came down tremendously. And so I thought we were in the clear, we were in the good. And then in 2023, I found out it progressed to myelofibrosis. And so that was actually a fluke that I ended up receiving that diagnosis because I was having different symptoms, such as fatigue and stomach pain, and went to the emergency room, was given some pints of blood and a diagnosis of myelofibrosis after having a bone marrow biopsy.
Well, thank you both for being here, and let's just dive in. So we're talking about understanding symptoms and what to track, right? One of the main challenges with MPNs is that the symptoms are often subtle and they can easily be mistaken for normal aging or other conditions like menopause and other symptoms or other conditions. Nick, what symptoms did you have that you noticed first? You alluded to a few of them in your intro, but what did you have first that prompted you to start tracking?
Yeah, for sure, the itching. Like you mentioned, a lot of the symptoms can be, you can sort of dismiss them, like headaches and fatigue and stuff like that. But the itching for me kind of stood out. It wasn't anything that I experienced before. And so that was something that really kind of raised the red flag on starting to kind of track that and monitor that and kind of monitor the details around when that would happen.
Probably the fatigue, because I have a high pain tolerance level. And so probably, the fatigue that I was experienced that would probably get to most people wasn't really getting to me. I think my adrenaline was just running as being a mom, a wife, and business owner, just a very demanding life. And I think I was just going and going and not really paying attention to my body as much as I probably should have been paying attention. It wasn't until at the day before I went to the urgent care, I was having really bad stomach pains, which I now know was my spleen. My spleen was enlarged, because my doctor informed me that when your bone marrow is not making enough white blood cells, that the spleen will kick in to try to do the job of the bone marrow. And that's not its job. And so, in the process, your spleen gets enlarged because it's basically doing something that it is not designed to do. And so that day, I also had some shortness of breath, which was very unusual for me, because I usually don't get out of breath. And so I just think I had ignored my body was sending me signs, and I just ignored it until it just gave me a dire warning, like, we can't go anymore. Something needs attention.
So, what kinds of things do each of you track now to manage your MPN, and how has that been helpful? Nick, why don't you start?
Yeah. So I track everything. Um, that's me personally, right? I want to know, you know, every little detail about what I'm feeling. And then I use that as a basis of part of my conversation that I have with my doctor. And I let my doctor tell me whether I'm crazy or not with respect to the symptoms that I'm feeling. But I think it's important to track everything. So much of our disease is a journey, and over time, and things pop up, they go away. And so I think you need to track everything, have the details around it, and then make sure that you're communicating with your doctor, because you never know what part of the journey, right? What symptoms that you're experiencing in every given part of the journey actually matter until you kind of look at everything.
I didn't track symptoms until the very, like, end, towards the end, maybe that last week before I received the myelofibrosis diagnosis. Um, I just kind of each day was saying, wait a minute, I am really, really tired. Like, I would go to the grocery store, come back home, and I would lay down, and I would need to sleep for like an hour and a half, and then I would get back up. And even with that, the other thing I think I dismissed too was a little bit of dizziness, because I had just had a sinus infection. So they were thinking maybe it's just, kind of a little bit of vertigo from the sinus infection. And so just thinking everything is isolated, that none of these things were related to this one diagnosis. I just thought they were all individual symptoms of something else. And so, like I said, that last week of the diagnosis of the myelofibrosis was kind of, each day I was noticing a little bit of progression. The fatigue was feeling a little bit more intense each day, until that last day when I had the severe stomach pain.
Yeah. And how do you track symptoms? Is it an electronic app or do you use a notebook?
Yeah, it's a combination of, an app. It's a combination of a spreadsheet. I would say very basic and the most useful for me is the Notes app on my phone, because I use that. I just open it up almost on a daily basis, and I'm logging stuff, and then I use that as the basis of my conversation with my doctor, right? So everything is there in between visits, and then I can kind of go over questions that I have and just things that I see, in that Notes app. So it's a combination of a few things.
And Nick, what's helped you to be consistent? Like you're tracking. What's made it easier and what helps you remember to keep it up?
It's fear, to be honest with you. It's fear of missing something that may play a role in, uh, change the change in course of my disease, right? Progression. So I'm very fearful of not tracking something, going to a doctor's appointment and saying, well, you know, have you experienced this before? And you say, well, I don't know, right? I haven't been tracking it. And then, realizing that it's too late. So quite literally, it's fear.
Yeah, that's real. So let's talk about symptom patterns, right? Do you ever
Mhm.
notice your symptoms come and go, or they get worse at certain times, or they come in waves?
I don't know that I necessarily noticed any patterns. It was just that it was a everyday thing. I was starting to notice that every day the fatigue was increasing. I don't necessarily know like the times of days, like if it was in the morning or the evening. I just know that when I woke up, I was fatigued. When I went to bed, I was fatigued. Throughout the day, I was fatigued. It was just an everyday thing.
What about you, Nick? I assume that's why you started tracking because our symptoms do come and go. Do you ever notice that at certain times of the day or certain days they get worse? What are you finding in your tracking?
Yeah, I think that's the probably the most important part of tracking, right? I'll give an example of itching. Itching was dormant for a while, and then it popped up over the last couple of years. And it's not just, it's at certain times of the day. In the morning, it pops up. All right. At night, it pops up, and then it goes away in between. When I take a shower, hot or cold, it
Mm.
pops up. When I rough house with my kids, just that rubbing of my skin activates it. I used to have bone pain a lot, and that's gone away. So it's one of the challenging parts of the disease is that sometimes it's unpredictable. Things come and go, and you don't really know. It's kind of the unknown, right? You don't know what's going to happen from one day to the next when it comes to symptoms.
Yeah, I think that uncertainty is really palpable, and I think a lot of us experience anxiety and stress related to that
Yes.
uncertainty. So it's always important to remember. Maybe tracking. You tell me. Does tracking help some of that anxiety because it tends to make sense of it, or is it the opposite? You see those kind of ups and downs, and it makes you worry more.
No, that's a great question. It helps me. It helps me because I feel like I'm educated, right, and prepared when I go to my meetings. I call them meetings with my doctor, right? I treat it very much like a work meeting, right? So I want all the information I possibly have walking into that meeting, and I just feel a little bit more prepared. So having the knowledge of like the ups and downs, and maybe the reasons why, I think is very very important for me.
Yeah, absolutely. One of the things, my transplant surgeon, that was one of the things that they really pushed for was for me to really be very observant of my body, skin changes, all of those things, because not only um, in terms of maybe cancer coming back, but also graft versus host with having the transplant. So, because sometimes your body can reject the transplant. And so they were huge proponents of me making sure that I am paying attention to everything, not just how I'm feeling, but any changes in my skin, my eyes, my throat, my ears, anything, range of motion, all of those different things. So now I feel better prepared because now I understand how important it is to pay attention to everything concerning your body and to make sure that I am saying and speaking those things to my care team so that we can be ahead of it and not trying to be reactive but more proactive, because sometimes those subtle things that we don't pay attention to could absolutely be the start of something, and if you catch it early enough, you don't sometimes have to go through the reactive stage of it, and you can stay ahead of it.
And so now we're tracking our symptoms, right? And we think about when it's important to share with our care teams. But has that directly led to any action, any changes in your treatment? And I'd love to hear any examples. We're not talking about specific drugs, but has it led to a change in your treatment or a change in your activities? Nick?
Yeah, for sure. So I talked about itching, and I brought that up with my doctor, and um, we kind of talked through it in the details and when it happens, when it doesn't happen, and all of that. And um, he recommended a couple of different options for me. One in particular that has worked, and so I very much, appreciated the dialogue and the brainstorming. That's one of the aspects that I really want out of my doctor is kind of brainstorming and idea generation. And so, yeah, that was, and it's been a life changer, to be honest with you.
When tracking your symptoms and bringing that information to your health team, it can make a big difference, as Nick was just talking about. So, what tips do you have for talking openly and honestly and clearly with your doctor and your entire care team about how you're feeling? Do you have any specific tips? What keeps you able to have an important open conversation with your care team?
One of the things, hindsight looking back, is um, I wish I wouldn't have seen the symptoms as isolated things, that I would have known to say to somebody, I'm having this these symptoms, like listing them all out instead of thinking, well, this maybe is related to the sinus infection, maybe this is related to this. And so not sharing with my oncologist or different people early on, other symptoms that are things that seemed random, not mentioning those things when they really could have been related to the progression of the disease, but just thinking they were isolated incidents. And so working with your care team, it's important to tell them everything that you're feeling. Like, don't think, oh, this is probably not related to this. Like, really expressing everything that's going on in your body.
Nick, do you have anything to add to that or something that specifically works for you to have a really open, honest conversation with your practitioners?
Yeah, for sure. I make sure that in the beginning of the appointment that we talk about, you know, how I'm feeling, right? Mentally, physically, symptoms wise, really kind of talk about um, how I'm feeling in between visits. I've come to know that and learn that doctors and caregivers they really want details, right? So they will ask details about what you're experiencing, how you're experiencing it, right? So coming prepared to the conversation right up front to kind of talk about some of the details on what you're feeling kind of creates a really nice dialogue with your doctor.
It sounds like you have a perfect doctor because
Well,
about we're always talking about how to have a productive conversation with your doctor and your care team, and so you've got it down, so I'm sure our listeners, or our audience will learn something from
Ruth, I learned that over time. Believe me, I learned that over
it.
time. It's not always perfect.
Yeah, same.
Uh,
And it's not as easy for everyone. So
no,
you're communicative, I'm communicative. There are people who are not. And so we always encourage them to bring a care partner with them so they can interact perhaps on their behalf or listen to think maybe perhaps they didn't hear certain things that their doctor said, or for someone who's not as outgoing and isn't as able to share how they're feeling or to remember, that care partner can step in and say, "Yeah, remember when, last week whatever, or, yeah, so all of that's really helpful. Thanks for sharing all that.
Yeah, I
Um,
think that's why like programs like this are so important, right? And to me, I talk a lot about connecting the patient community, right? Because you can learn a lot from the patient community and gain some courage that way. So
as one more follow-up to that, has any of your tracking changed, not just your treatment, but new has it raised new concerns that you were then, looking at with your doctor, questions and answers that perhaps would not have come up before?
yeah, it was the tracking of phlebotomies when I was being treated solely with phlebotomies and kind of the impact that was having on me physically. Right, like for a while, I was able to um, kind of deal with the phlebotomies well, but then over time, it really had an impact on just my overall health and well-being. I just wasn't tolerating them um, as 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 well as I was in the past, and so we started talking about different options. Um, Not only were they not making me feel well, but I was getting them too often, right? And usually that's a little bit of a red flag, as we know with MPNs. And so it really changed the conversation of looking at different treatment options um, with respect to my care. So
And I think that speaks to how important it is as a patient/patient advocate. Sometimes we see doctors who ask us yes and no questions, right? Like, "Are you doing well with your phlebotomies?" And it's either a yes or no. But if you expand on that and say, "Yes, I'm tolerating, yes, I'm going, and yes, I'm having them, and they're helping my blood counts, but I've been experiencing this, or I've been experiencing that." And if a patient, if a person living with an MPN or their care partner doesn't always step in to add to that yes and no question, we don't progress in our knowledge and therefore better care. So thanks for going there. It's really important for other people living with MPNs to hear different people's experiences. So let's talk about progression. Nobody wants to talk about progression, or we all want to talk about it. We don't want to go there, right? So knowing that MPNs can progress over time, ET to PV, like for me, PV to MF, like I experienced also, MF can progress to AML, acute myeloid uh, leukemia, which we know. So that can bring up a lot of emotions, right? And a lot of stress, sleepless nights. Sometimes we hear that sleeplessness is a side effect of living with an MPN. I also really believe that it's not necessarily or always a molecular or biological response based because of your MPN. I think it's the stress. I know for myself, I don't think about any of this during the day unless I'm doing a webinar like this. But when I close my eyes at night, that's when I allow everything to circle around and it keeps me from sleeping. So I think it's important to talk about this balance, reality versus staying present and grounded and in your day-to-day life. We don't want the anxiety or stress to take over, but it's nice to acknowledge that it's real. And in my in my opinion, it's equally important for others to acknowledge that it's real because sometimes we feel misunderstood. So Demetria, again, I'm going to start with you. Are you worried about MPN symptoms coming back?
Um, so I'm a woman of faith. So I rely heavily on my belief in God. It has anchored me throughout my journey because I don't believe that I don't believe in crossing over into fear. I think it's healthy to have concern and caution about things, but I try not to go too far into the future because that's when anxiety sometimes can arise. It's because you're going too far into the future thinking the what ifs, and sometimes the what ifs never happen. And so for me, I rely on my track record. Like that guy has always pulled me through. And so I just believe that if something else was to arise, that because I'm anchored in that belief that I'm taken care of spiritually, that it's going to be okay, because sometimes we do have to go through journeys, we do have to go through valleys. But it's how you respond to those valleys that make the difference.
So Nick, what about you and living in the moment and not worrying about progression? But I also wonder if you've spoken to your doctors about this because some doctors don't ever ask about our mental health. They don't make that connection, and some do, of course.
yeah, it's a great question. I've been very open and public about some of the mental health struggles that I went through, especially early on. It was just a very shocking diagnosis, confusing diagnosis. And I really kept everything inside. I didn't communicate at all to my wife, to my family. And it just was, it was deteriorating my mental health inside. And so um, what helped me was communicating. I just communicated a little bit better with my wife. I did that through a documentary that I did, which was kind of life changing, to be quite honest with you. And it's not really about the documentary, but it's about, for me, it was about getting involved in the cause. It made me feel like I was doing something to help. And you quickly realize that it's not about you, right? There's a greater cause out there. There are other people that can help by sharing your story and communicating. And that was really the turning point for me, was just getting involved a little bit more in the cause. I did seek professional help. Um, I remember going to the emergency room a couple of times because of the anxiety pains that I had, which I thought was I was having a heart attack.
Yeah.
Because at that point, everything was just all bottled up inside, and then again, that was another pivot point to really seek some professional help. Um, and both of those things were just life changing to me. So, I talk about this all the time. Don't be afraid to communicate. You have to communicate because it kind of was a release point. Get help and also connect with other patients. Really connect with other patients. It's so life changing to speak with someone that is going through something similar, may have a different perspective. It really is valuable. So that would be my advice.
Yeah, and all of that is thanks to the internet. Obviously, when I was diagnosed 30 years ago, the internet was in its infancy, and I didn't have resources like the patient's story, which are really invaluable for those of us living with any chronic disease, and particularly chronic cancer and an MPN. Let's move on to the role of care partners, and I'm talking still specifically about symptom tracking. So, do either of you have someone helping you track symptoms or to notice changes that you might miss?
So primarily my husband and then my mother. So my mother has a background in the medical field. Sometimes she would accompany me on some of my visits, and she would ask a lot of questions that I may not have known to ask just because of her background. And then when I had my bone marrow transplant, I had to have a caregiver with me for the amount of time that I was allotted for that journey. And so my mother and my husband alternated because I had to go to another city to have the bone marrow transplant, which was 2 hours away from where we live. And so, and then my husband and I, my daughter at the time was 10. So, he had to navigate still caring for her as well as caring for me. But they were, some of my biggest, supporters in terms of even my husband. I remember one doctor visit, and there was something that I was starting to itch a little bit. And so I hadn't said anything to my oncologist about the itching. And he was like, well, you need to tell him about the itching. And so he was like, well, what about the itching? And I was like, yeah, I've been having a little bit of itching. So, both of them being on my team, like things that I didn't say or didn't know to say or forgot to say, they would kick right in to say those things for me.
A lot of times people will go to their doctor and say, "No, I've been fine. Are you fatigued? No. Have you been tired? No." And then the care partner puts their little hand up and says, "Well, we've had to rest a lot when we've gone on our 2-mile walks every morning and they are going up the stairs." And so the people in our lives play a role that I think is important. Have there been times when your caregiver noticed something you hadn't picked up on at all or yet?
Kara, my wife, is my caregiver, and I don't know where I'd be without her. We do a lot of communicating now. We will, and I've mentioned this before, that we treat the doctor appointments like business meetings. So I will prep with her. We will go over, my notes that I have, what I'm feeling. She'll ask me questions to make sure that I'm actually being honest about what I'm going to talk to the doctor about, and then we'll do like a debrief. What did the doctor say? What do your numbers look like? And then everything in between. She actually, I give her a lot of credit for this, where I was having trouble with my vision, right? I've had blurry vision before, but I was having just issues all of a sudden, just seeing, right? Everything was kind of coming up blurry. And she says, well, you've been on a certain drug for a while. Do you think that has any effect? Why don't you bring it up to your doctor? And lo and behold, it does, right? There is an impact taking certain drugs with your vision. And so she's fantastic. She's a lot smarter than I am, and so I rely on her a lot.
Okay, yeah, Demetria, this is a follow-up for you. Does your care partner support you emotionally, or better, how do they support you emotionally, particularly when you're dealing with anxiety?
And surprisingly, my husband and I, we've had these kinds of conversations, and he said that the way that I was so calm and remained calm through all of this actually helped him to stay calm, because as a husband, you know, people look at the husband as the protector, as the one to shoulder, even the emotional to keep the household calm. But he has shared with me that he watched me and he watched how I was calm. And so it helped him because, you know, he felt as if there is nothing I can do. Like there's nothing I can do to help my wife, in terms of getting through this. We just had to work through it, work through the process. And so I think his presence, there is even an emotional and mental components just by someone's presence being there. It feels confident. It feels like you are seen. So he sees me. He sees that I'm going through this. I feel secure because he's here. He's not leaving me by myself to go through this journey. So I think even though he may not have offered like any specific emotional or mental help in terms of the traditional sense. I think just his presence of being there and being willing to sacrifice to go through the journey with me was enough for me.
So we're moving on to clinical trials and looking ahead. And that's important because some of the best drugs for MPNs are still in clinical trials. Like I like to say that clinical trials are no longer a last resort. And I'm a perfect example of that. I've been in one, as I said in my intro, for 5.5 years, and I'm doing extraordinarily well on that trial. There are challenges. I have to go back and forth 3.5 hours each way to the major academic center that I'm seeing for that clinical trial, but I'm having a life-changing result, and to me, that's worth it. By the same token, everyone doesn't have access to clinical trials, which is, difficult, and we acknowledge that. But let's talk about clinical trials just a little bit. Has your doctor ever brought up the idea of clinical trials as part of your treatment plan? I hear often that I heard from an MPN doctor just yesterday that if we asked every patient or every person living with MPNs if they were willing to participate in a study, 90 something percent would probably say yes. The only obstacle is that they're not asked. What about you, Demetria? Have you ever been offered a clinical trial?
I haven't ever been asked, but I have been told, especially when I was at Emory, because they do participate in a lot of clinical trials. And so the conversation was if this medication does not fare well with you, then we could look at maybe putting you in a clinical trial.
So what about you, Nick? Is that something you've been asked about?
Yeah, I will answer this maybe a little bit different of a way. So when I first got diagnosed, I really focused on my diet. I kind of brought that down to zero, tried to take out a lot of the inflammatory foods I was eating, and really just made that a focus of just my overall care. And my doctor knew that at the time. I talked about that openly with him, and he had heard of a not so much clinical trial, but a diet study that Dr. Fleischman was doing on the West Coast to really take a look at the Mediterranean diet and the impact that that has on MPNs. And so he thought that would be of interest to me, and it was, and I participated in it, and it was just nothing short of fantastic. It validated some of the things that I was doing was correct, but also exposed some of the things that I wasn't doing, and some of the nutrients and proteins that I wasn't getting based on my diet, and even iron. Right, we need a base level of iron. We don't need too much iron as MPN patients, obviously, but it was great. It really was an education piece for me. So not so much a drug clinical trial, but more of a diet clinical trial. And I think it's important for people to know that those kind of studies and clinical trials are out there, outside of the drug and that we typically see.
Yeah, thanks for mentioning that. Dr. Fleischman's studies are really interesting, and we can learn a lot, not just from the Mediterranean diet, but for the Mediterranean diet's influence, if you will,
Hmm.
picking and choosing what works for us, but understanding inflammation's effect on MPNs. If you were asked, whether it's today or things change, what would your care team be able to do to make you feel comfortable exploring a clinical trial?
For me, it would be, um, it kind of starts before talking about the clinical trial. And what I mean by that is I really feel like you need to have an open dialogue throughout your care with your doctor, right? So I never want to feel complacent with where I'm at in my care. And so constantly challenging my doctor, what's out there? What could we be doing differently, if anything, right? What's on the horizon? What if this happens? What do we do? Those are the type of questions that I ask my doctor, maybe every other appointment, right? Like just kind of brainstorming. And so if you're having those discussions, it makes that conversation of clinical trials a little bit easier, a little bit more comfortable because you've already talked about it. So I think starting with having a regular cadence of talking about the what ifs and what could we possibly do if things change will help with that conversation about clinical trials and ultimately participating in them.
Yeah, totally agree, and sometimes we have that conversation long enough that the clinical trial becomes an approved drug, and we don't have to have
Yeah.
that conversation anymore.
Yes.
Um, have either of you ever come across a clinical trial in your own research that seemed interesting, but you didn't know how to move forward, or you didn't know, how to talk to your docs about it?
Well, I would say I think that's where the communication part comes in with the patient community, right? Also with organizations like the Patient Story, they can get you resources and someone to talk to further vet that out, and then ultimately maybe find an MPN expert to really talk through that in a little bit more detail.
Well, I actually initially, when I was diagnosed with the ET, the oncologist that I was seeing at that time, the medication, because I was very young, I was about 34 when I was diagnosed, 35. And so the medication that she put me on, I did some research on it, and I said to her, my husband and I may still want to have children, and this medication is, not going to fare well with me if that is the case. And so I asked her about, I had researched some new medications and clinical trials that were out, and there was one particular doctor that I mentioned to her that I saw was like making headways, introducing new concepts, new treatment plans, I asked her, is there a way that maybe you can see if these things would work for me? And I didn't feel like she was willing to do anything other than what she suggested. And so that's how I ended up at Emory, because I felt like this is my life. I have to be an advocate for my life. I have a husband and a daughter. I want to live, and if there are newer things out there or new things that are coming, I want to be able to be in the know and to figure out how can I benefit from the newer things that could be better than what she was offering.
So if things changed, Nick, are you open to participating in a clinical drug trial if at some point that became the right choice for you?
Of course, the way I look at my disease and the care is it's basically all options are on the table, right? I want to live as long as I possibly can, and I will do whatever whatever is necessary to make that happen. So yes.
Well, thank you for sharing that, and I will just add that, the longer we're here on this earth, science is advancing at unprecedented speeds. And again, 30 years ago, things were so different. 20 years ago, 10 years ago, even 5 years ago, for that matter, 2 or 3 years ago, our options have expanded, exponentially. And so the longer we're well enough to live a good quality of life while we wait for new and better treatments to come along, those decades add up, and that's a really good thing. So, just to move on to final reflections and advice, what advice would you give to someone who was just diagnosed with an MPN about tracking symptoms specifically? Is there anything you've learned over time about how to talk to your doctor so they really hear what's going on and they really hear you that you're tracking your symptoms and therefore you're a knowledgeable patient? Nick, why don't we start with you?
Yeah, I would say track it all. Do not think that any one symptom is too insignificant. Track it all and let your doctor tell you, nope, you don't have to worry about this. Yes, you should worry about this. So please track it all. Um, be prepared for your doctor's appointments. Do the research. Communicate how you're feeling, and then be open minded. Be open minded with treatment options. Be open minded in getting the care that you need with whether it's an MPN expert, whether it's a mental health expert if you're struggling with that. But be open minded, please.
I would just say to people, pay attention. Life is fast. I call this the microwave generation. We do everything fast. We want everything fast. And sometimes when you're moving really fast, like I was, you don't get a chance to pay attention to what's going on inside of you in your body. You're just moving through life. I look at it like sometimes when you're driving and when you're on the highway, you're going so fast you can't see anything. But if you're going the back roads, like my husband and I went to Asheville, North Carolina, and we had to go around Ocoee. And Ocoee, you have to slow down. It's not the highway. You can't go fast. But we were able to see the scenery. You pay attention to things. We saw the beautiful water, the rocks, the trees. And so when you slow down, you can pay attention to see what's going on. So my advice would be sometimes we need to slow down and to pay attention and be intentional about looking at ourselves, looking at our bodies, self-evaluating. How do I feel? How long have I been feeling this way? And don't just discount it as a fluke or some kind of isolated incident. Take it seriously, take it to your doctors and find out what's going on so you can live.
Thank you so much, Nick and Demetria, for sharing so openly today. Your stories are a powerful reminder for that even small steps, like jotting down a symptom, can have a big impact and make a real difference in managing your health. So, thank you also to our audience. If you're living with MPNs or caring for someone who is, we hope that today's discussion has left you feeling a little more informed, supported, and empowered, a little less invisible and misunderstood. We do want to thank our sponsors, Incyte and Karyopharm, for their support of our educational independent program. This allows us to be able to do some more content like this one today and at no cost to you. The patient story does always retain full editorial control. And while we really hope that this is helpful, this is not a substitute for medical advice. Please still consult your own healthcare teams when making your healthcare decisions. And finally, we really want to hear from you. So there's going to be a survey that pops up after this discussion closes. It'll only take a couple of minutes. Please share your feedback on today's discussion and also what you want us to cover next. Thanks so much from the patient story.